Last week, the South Dakota Department of Health reported the first influenza death of this flu season. According to the DOH, an average of 33 flu deaths are reported each year in South Dakota. Parker Brown has more in our top story tonight. Good evening, Parker.
Good evening, Cordell. Experts say that right now is the best time to take preventative measures. The DOH and Avera are working to keep the public informed on how you can stay healthy and safe from this respiratory illness.
Caused by influenza viruses, the flu can have symptoms that range from the common cold to even severe illness. Avera Vice President of Clinical Quality, Dr. David Basil, says that it should not be taken lightly.
Sometimes, especially in older individuals or those who have multiple chronic condition, it can even be fatal, and it tends to be one of the more common causes of hospitalization during the winter months.
Along with the first reported death this flu season, the South Dakota Department of Health reported 215 confirmed flu cases and 15 hospitalizations so far. It's a small number, but it's still early. Dr. Basil says that this year projects to see average flu numbers.
During the COVID years, influenza kind of went away from its cyclical pattern a little bit, and we're thinking now that we're going to go back to a more cyclical pattern. What we traditionally see with influenza is a little bit of a peak in December, and then it drops for a few weeks, and then kind of into later January and February, we see a bigger peak.
As a respiratory illness, the flu can spread quickly, and it's spread through small droplets. The best ways to slow the spread or prevent infection, according to the DOH, are washing your hands often, avoiding touching your eyes, nose, or mouth, covering your mouth and nose when you cough or sneeze, staying home when you're sick, and avoiding close contact with people who are already sick. It's also recommended to take a flu vaccination to help your body fight off the virus. Dr. Basil says it's important to do so early for one specific reason.
The flu shot takes several weeks to take effect, and so you can't really wait until you see a lot of flu circulating in the community to get your flu shot. Now is the time to get it if you have not already, so that you've had 2 or 3 weeks for your immune system to react and build up to it, so that when flu really does take off, you're prepared.
Dr. Basil says that your flu shot would last through the rest of the flu season. Flu vaccinations get updated based on what strains are circulating overseas and what will make its way here. Cordell?
Thank you very much, Parker.